Welcome, friends, and thank you for tuning in to another episode of the Optimal Health Program. Today we're going to talk about osteopathic medicine. This is something that some people do not know about. I myself am an osteopathic physician. We're going to interview Dr. Joseph Samlund, who's also an osteopathic physician. He specializes in manual and osteopathic manipulative evaluation and therapy, which is a terrific pursuit. A great deal of information over many, many years has come out about the essence of osteopathic approach, which is a comprehensive nutritional medical approach, as well as a physical approach, understanding the body. Originated many years ago, and we'll talk about the history. Dr. Samlund will bring that all up. But it's better and different than the traditional approach because we're looking at more, learning more, and we're able to work with more. So that being said, Dr. Samlund, thank you for coming on the program.
Great to be here, Dr. Calapai. Thank you. Thanks for the opportunity to discuss this.
Well, it's an important discussion. Many people are not aware that osteopathic physicians are in every state in numbers and well into the thousands, and there are over 60 osteopathic schools across the country and many throughout the world. And how would you describe the overall osteopathic approach? I believe it's the original holistic approach.
I would agree with that as well. So the field osteopathic manual medicine or osteopathic manipulative therapy is what the osteopathic profession was founded on, and it was very novel at the time. It was in the late 1800s. The very first osteopathic school in the country was started in 1892. And
in Kirksville, correct?
In Kirksville, Missouri. It still exists today. There's a wonderful library at Kirksville that has troves and troves of information about our field. And the concepts that Dr. Still is the founder of the field, the concepts that Dr. Still was professing and teaching were very, very new and innovative at the time. And it really balanced on this concept that the structure of the body will affect the function of the body. Mm-hmm. So structure and function are intimately related. And that was a pretty new concept at the time.
So generally the idea is that you could have issues with your back that may be, and this is a very oversimplified comment, issues with your back or your neck that are affecting blood flow to different tissues and muscle, etc., but also affecting nerve ability to get out to your skin, your muscles, and your organs. And I talk about this with patients all the time. The brain comes out to the spinal cord, your nerve roots come off of that, they go to your skin, your muscles, and your organs. So issues with your back, the somatic, as you'll explain, affect visceral, the organs inside your body. So there are things that could start at your back and affect your internal organs and your function.
Right. So a lot of what osteopathic physicians work on or help patients with are painful problems. And our approach is very different from physical therapy and from the chiropractic approach. But we don't just work on painful problems. So musculoskeletal issues, common problems like herniated discs, low back, neck pain, things of that nature I see in my office all the time. But we are also able to help other more, so to speak, visceral issues. People that are having breathing issues, like patients with emphysema and COPD, headaches. I treat a lot of patients that have GI issues. And it goes back to that idea that the structure of the body will affect the function of the body. So many common problems will affect the structure of the body. And so the job of the osteopath is to examine the patient and find some of those problems and correct them. Some of them are related to the spine and painful problems, and some of them are related to non-spinal issues. My job is to get the body to work together. The analogy I give is I'm a conductor, and I'm trying to get the entire body in concert, in tune, in the same rhythm, and that's when patients will have terrific results.
I remember seeing patients that you've treated as well, and some of them with breathing issues, and people don't understand that the muscles and their control and the rib movement and the muscles between the ribs, the nerves that run along the bottom of the ribs, all can control how someone breathes. So it's not as though your lungs are the only component of breathing. So I remember, and certainly you've done it on me, you worked on my back, the thoracic spine, and all of a sudden you start to feel like you have this ability to take a deep breath, and now your ribs are moving normally, etc. So you can feel when your body's tight and restricted, and when it's in more normal function and position.
Well, absolutely, and I love treating pulmonary patients, whether it's a pneumonia or a bronchitis, upper respiratory tract infection, chronic obstructive pulmonary disease, or even asthma. All of those pulmonary issues will affect the musculoskeletal system, and when we treat the rib cage and the thoracic spine and the muscles and the diaphragm, we can help those patients to breathe easier. And another component of osteopathic manipulative therapy that we focus on is lymphatic flow, helping with lymphatic drainage from each part of the body. The lymph system drains the entire body, including the brain, the central nervous system, and it all empties into our chest cavity, into the common duct, thoracic duct, and by helping the lymph move, we can help the body rid itself of toxins and metabolic waste products.
Well, people take for granted, you talk about a lymph node, and they'll have a sore throat or a dental issue or an infection or an abscess, and they know about swollen lymph nodes and glands, but they don't understand that they're all interconnected, and the pathways and the channels that flow everywhere in and around all of your tissues can bring things back to the lymph node to trap and then to try to have your immune system go crazy on, attacking or killing that. So we all take it for granted when we say, I have swollen glands. So people don't understand the complexity around that entire mechanism of the glands being swollen.
Well, and there's a lot of things that we can do that will help increase the lymphatic drainage of that area. So you get those swollen glands when there's an inflammatory or an infectious problem going on, and the lymphatic vessels are very, very flimsy, for lack of a better term. So tight tissues, including tight muscles and tight fascia, can interfere with lymphatic flow. And so working on the soft tissues around those areas, we can allow the lymph vessels to drain a little bit better. And that is also, that sometimes is just what the patient needs to get over that hump, to recover.
So trying to paint a picture of that, and obviously what I've known and seen over all these years, you could have muscle spasm in your back or your legs or your glutes, et cetera, anywhere in your body, and that could affect that flow of lymph and, the fascia and connective tissue that are going to be affected within and around the muscle, and the different layers of these tissues can affect that and impede the lymph from flowing appropriately. And working on that allows that flow to come back to a much more normal state.
So I can give you a few examples, but the one that comes to mind is a lot of times patients will have, let's say, a hernia repair, or maybe they've needed pelvic surgery for an issue, and the surgery went well, there were no complications, everything healed, and they're feeling pretty good, but they notice that one of their ankles is starting to swell up occasionally. They never had that before the surgery. And nobody did anything wrong. The surgery was beautifully done. But the tissues around the incision have tightened up. And that's enough to sometimes impede lymphatic drainage from the lower extremity.
Makes sense.
So, a lot of what osteopaths who use their hands, like myself, all day long, we do work on bones. That's how we got the word osteopathy, osteo meaning bone, Dr. Still said we should begin with the bone. But then we work on muscles, tendons, ligaments, fascia, lymphatic vessels, venous vessels. And a lot of times the patient will ask me, oh, that feels interesting. I can feel things shifting inside. What is it? What are you doing right now? Or what are you working on? And I usually tease them because I'm never working on one thing. When I put my hands on a patient in one specific area to, let's say, release some of that tissue tension that's impeding with lymphatic drainage, I'm working on the skin, the muscles, the bones, the ligaments, the fascia, the soft tissues, and it's going to affect the arteries, the veins, the lymphatic vessels, and very often, if any of those problems are associated with pain, that will also change and improve.
Yeah, so once again, the comprehensive or the holistic or the total approach, again, that is obviously one of our mantras, one of the things that we believe in. And it's amazing to see in such a short period of time how much better you can do. I remember being in school, and probably first year of school, and I had, just sinus pressure and a headache, and I just felt, like my head weighed a ton. And I asked one of the teachers, to help me out with that. So I was laying on the table, they put their hands on, did a variety of therapies, a little bit of pressure changes, and potentially a little bit of craniosacral, which I'd like you to talk about. And then the teacher said, just wait a few minutes, then here I'm going to give you some tissues. He said, if you need to, you can head over to the bathroom. I didn't really think that much of it. But as I went to sit up, I had so much literal fluid drainage from my sinuses. It was, unbelievable. I ran to the bathroom, totally cleared everything out, and of course, my sense of smell and all this pressure's gone, and my head had felt like the weight was all gone, but it drained a lot, so.
That's really funny. When I treat a patient who comes to my office with bronchitis, structurally what I'm usually going to find are problems in the neck that's related to the nervous system, and problems in the thoracic area, the ribs and the thoracic spine, and the diaphragm. And I treat that through a variety of different methods. And when they leave the office, I always give them a few paper towels because, and I would say probably 1 out of 5 patients, when they come back a week later or 2 weeks later, they thank me for giving them the paper towels, because by changing the structure on the way home, on their drive home, they'll often have to pull over and they start coughing up a lot of phlegm, just getting it out. And they know, then they get to see just how they feel better when they leave, but getting all of that congestion out is a big relief to them. And we laugh about it a lot, because when I give them the paper towels, they look at me like I'm crazy. And then a couple weeks later, they're like, thank God you gave me those paper towels.
Yeah.
And you touched on the cranial concept, which is a big part of any osteopath's treatment skills. And I think that there's a lot of misconceptions about that, but it's just another style of treatment, and it focuses on the motion. There is motion in the skull. It's not one solid bony globe. There are I think 22 bones in the skull. They all have interdigitated articulations with adjacent bones, and there's an inherent motion of those bones in the skull, and very often part of a patient's issue is that those bones and the membranes inside, the dura membrane inside of the skull, have been affected by an issue. It could be trauma, it could be an infection, it could be a lot of different things. And that's a real fun way to treat. And when that's what the patient needs, if you do it well, you get fantastic results.
I remember in anatomy in our first year of medical school, and dissecting cadavers and such, which really was the most fascinating thing I've ever done in my life, and I can't imagine anything more fascinating than that, because you're learning about things that you can't understand until you actually see. And doing dissection of the brain and looking at the membranes and the meninges and the falx cerebri and cerebelli, and you think your brain and most people don't think about it, but your brain is sort of held in position by some of these membranes, but then fluctuations in the positioning of the head on the atlas and the axis, and whether the membranes are taut or loose or not can affect how your brain is functioning. It was fascinating to me, but to be able to see that firsthand and actually touch it, when we did dissection was outstanding.
Well, I get to play a game with some of my patients. It's usually pediatric patients or the parents of the pediatric patients. A lot of times somebody will bring their child in because they have an ear infection, and they know that what I do can help the ear to drain. And when I put my hands on the child's head, and this happens in adults as well, very often I can feel the side where the infection is just from the cranial motion. The cranial motion is impeded by the infection. And I'll tell the parent, oh, it's the right ear. And they're like, wait, I didn't tell you that. How'd you know that? And it's because you can feel that what is normal, and you can feel what is abnormal, and you can feel that right side is abnormal. And by working on the skull, you can help open up that ear and help with the infection. And I treat a lot of adults that have something called eustachian tube dysfunction, and that is a problem that a lot of people experience occasionally, and it's when your ear feels full. Sometimes people describe it as they feel like they're underwater, and it's the same treatment approach to a similar problem. In the pediatric patients, they've developed an infection, and in the adult patients, they've just developed congestion and an accumulation of fluid behind the eardrum, and treating the skull can help that to drain.
It's interesting, and I've always said, the body is an extremely complicated mechanism, and there are so many different variables that it's a wonder that more things don't go wrong, all the time. But the physical facts of the body, some people like to talk about, medication for this and medication for that. You can't ignore the physical facts of the body. You can't ignore the eustachian tube, whether it's clogged or, whether you can't drain fluid or mucus, et cetera, from there. You can't deny the fact that the musculoskeletal system and all the connective tissue play a role in so many different things that we see, hypertension and heart disease. The list goes on, digestive issues. But these are tangible, no pun intended, hands-on facts that we have to take into account.
You're preaching to the choir here, as you know. And I have this conversation with my patients all the time that, Western medicine has evolved into pharmaceutical medicine. And we use a lot of chemicals, a lot of pharmaceuticals to help treat problems. And I'm glad that they're available. But so many problems, I would say almost every problem, also can be addressed to some degree through the physical component, not just the chemical component. And a lot of times the problem needs the physical component. And so it's a great tool to have.
So typically when you're treating a condition, it could be any condition you want to chat about, how many treatments does a person need to start to see some of the changes occur? And do they do maintenance treatments over time?
So that's a great question. It really varies, but a lot of times I'll see patients who've had a problem for years, 3, 4, 5 years, sometimes even longer. Sometimes they've had surgery to correct that problem and it wasn't that effective. And almost all of those patients have done other forms of therapy. And so I explain to them, the longer you've had the problem, the longer it's going to take to correct this problem. But I use a benchmark from myself. And I explain this to the patients that usually within the 3rd visit, they should start to feel some changes. Now, if it's a newer problem, very often they will only need 1 or 2 visits to fix that problem. So the longer standing visits will take a little bit time to coordinate the body. And as far as maintenance goes, so some people need maintenance for their problems and some people don't. If you have an acute injury and you're having trouble you've done some physical therapy or some other things, you've taken some medicines, and it's still bothering you. Let me give you an example. Tennis elbow. So tennis elbow, the standard of care is ice and rest and bracing, and or physical therapy, and or some anti-inflammatory medicines, and or cortisone injection, which the orthopedist's office will often provide. So sometimes that does the trick. But very often those patients will have tennis elbow that's lingering for months. It goes up and down, but it never really goes away. And what I find in those patients is that one of the bones in the forearm, the radius, is out of position, the radial head is out of position. If I treat that radial head once or twice, we can get that to finally go away. And so for those patients, there's no maintenance.
Mm-hmm. Yeah, it's amazing to think that it's relatively easy to have displacement or areas of your body, and of course we know it, for the back and out of position. And people, say, oh, my back is out, or I want to go get my back adjusted. But you've got to look at it in a more comprehensive fashion to be able to do some of the exercises to correct and strengthen your back. I know for a long time I would have pain in the middle of my back, and if I wasn't working out, doing some back exercises, it would linger. And then if I were to do some back exercises, bent over rows or activities that made my back muscles a little bit more strong, it kept me in position, and I didn't end up having the same, and maybe it was a rib dysfunction, but I like the fact that, and certainly the way that you teach it, and more people are getting into doing some activities at home that create the strength and the stability. So I think it's got to be looked at in a comprehensive way.
I think that most hands-on osteopaths who practice osteopathic manipulative therapy full-time, most of us have give our patients appropriate stretches and sometimes some strengthening exercises to start at home to help with the problem. And if they need physical therapy, we'll send them to physical therapy. Sometimes that's what's necessary. But some initial stretching is usually very helpful.
So in a perfect scenario, you'd want to do the eval first, do a little bit of work, and then be able to refer out to different things depending upon what they need, again, based on your evaluation.
Absolutely. So the backbone of the work is the osteopathic structural exam. And it's a detailed examination of the body, and it does look at positions of bones, but it also looks at tone of muscles and range of motion in joints, and it's all done with a focus on how do those tissues feel. So we talk about when we work with the students, we talk about developing palpation skills. So after more and more years as an osteopathic physician, you can feel more and more issues, and you can identify subtle ripples that are overlooked by other medical professionals. And very often it's those subtle ripples that need to be corrected for the patient to feel better. And they're often frustrated that they've done X, Y, Z, A, B, and C and haven't gotten better. And that's because all those other approaches dealt with the more obvious issues, and some of them were corrected. But the ones that are left are subtle, and you need a certain palpatory skill set to identify them and to correct them. And that's when the work is very rewarding, and the patients are very surprised because that work is often very, very gentle. And they can't believe that such a gentle approach is the thing that got them feeling better.
Yeah, it's in a way, it's treating something but not covering all of the bases or all of the underlying causes. So a person gets a little bit of benefit, but then it doesn't last, or it's not, complete. And what always comes to mind is that traditionally doctors, when we look at thyroid hormone, will only test T4 and T3, rather TSH. So if you look at T4 and TSH and they're normal, you could have low T3, you could have low levels of the T3 and T4 uptake in the free or thyroid antibodies and have an autoimmune disorder. But if you're only looking at two parts of the picture, you can't get a complete, understanding. And that's why people don't do well, or the doctors miss the fact that the T3 is low, and we need to correct that. So Yeah, there's so many different variables within these conditions that need to be, thoroughly evaluated. What are some of the techniques that you like to do? I remember certainly back in school, craniosacral, myofascial release, some of these things that work directly on, the entire mechanism.
So what I explain to my patients is that my bag of tricks is pretty big. And so under the umbrella of osteopathic manipulative therapy are at least a dozen unique different approaches. There's a high velocity, low amplitude. And that's the technique where I think it's associated more with subluxations. That's when you, in a very controlled fashion, you move the spine and you get that little pop, that click. And I don't do that on most of my patients. I do more of the soft tissue techniques. And the technique that I use the most is called balanced ligamentous tension. And it's a gentler technique that requires a more developed palpation skill set. Then there's counter strain, which is positioning the body in a certain way to relieve pain. Then there's something called muscle energy therapy, where you position the patient in a certain way and you have them push or pull to help move a joint and relax muscles. Then there's facilitated positional release. Then there's the Still technique, named after our founder, Andrew Taylor Still. Then there's lymphatic treatments. There's and there's a handful more, and they and very often one sort of blends into the other. You start with one technique and it turns into something else. It can be done as distinctively separate, but it can also be done where you begin with one and it blends into something else, and you change the position, and that's how that's how you make changes in the body.
And so you're able to monitor a person's progress from one visit to the next to see which things are working, and you could adjust and change course.
Yep.
Yeah, it makes a great deal of sense.
And I think that I teach at the medical school, the osteopathic medical school here on Long Island, a couple days a week, and I really enjoy it. It's a lot of fun. But one of the things that I will talk to the students about is when in medical school, in order to learn things, we break it down into systems. So there's the endocrine system, the gastrointestinal system, the pulmonary system, the cardiac system, et cetera, et cetera. But there really is no section on just the musculoskeletal system. So the musculoskeletal system overlaps with the orthopedic medicine way of looking at things, a little bit with the neurological system. But the musculoskeletal system really deserves its own own category.
Yeah.
Because it's all of our bones, muscles, nerves, the connective tissue, and we're not static beings. It's all of that on a planet with gravity while we're moving. And so there are an unlimited number of problems that can develop. All the bones, all the muscles, all the nerves, all the positions, moving, falling, et cetera, et cetera, et cetera. And that's the job of the osteopath, to get that to work together
What are some
better.
of the more interesting cases that you've worked with?
So I just recently started to treat a lovely lady a few weeks ago who had, for most of 2024, had some intermittent vertigo. And it was none of the classical benign paroxysmal positional vertigo. It wasn't an infection like a vestibulitis. And she had seen some specialists and they did a lot of testing on her. And the conclusion was, well, there seems to be a little problem in your inner ear, but you can try an antihistamine, that may help. And when I examined this lady, I found cranial issues things that I could address that I think would help with the cranial motion, that could help with the vertigo. But I also found a lot of cervical spine issues, a lot of muscle tension and malpositioning of bones, and also something that we address is the position of the skull on the cervical spine, on the neck. Is it in the right position? Does the skull sit on the neck in the right position? And so treating this lady for just a couple of visits, and she's a very happy patient. She hasn't had vertigo for a couple of months now. She doesn't feel like it's going to come back. She said in the back of her mind, she always felt a little off and that it could happen at any point in time. And she did have neck pain, and her neck pain is much, much better. But if I may continue, Dr. Calapai,
Sure.
So one of the things that I've really enjoyed doing in 2025 is treating post-concussion syndrome patients. And this approach, these techniques and my approach for most of those patients, I would actually, in 2024, I would say with all of those patients, has really, really been a lot of fun for me, very fulfilling, and I've been able to help patients that have been suffering, some of them for quite some time, and it's just with this osteopathic approach. It's a whole body approach, but for those patients, we focus more on the cranial anatomy and cranial dysfunctions, and it's been really, really rewarding. And I'm actually trying to put together a research study with the faculty at the school and one of the local hospitals.
That's great.
Yeah, because a lot of these patients, so that's an example of those patients need not the chemical, not the pharmaceutical. They've done that. It hasn't helped. They need the physical component. They need the mechanical, physical, hands-on approach.
In most cases, it's a physical injury where they're hit in the head or they fall, and that physical, nature of the problem has to be addressed.
Yep.
And you can't just use a painkiller to try to see if that'll take pain away, because you're not changing the underlying or the root cause of the problem. So a lot of great information. Certainly, we'll love to have you back and give us updates. We do this with a lot of our people that we interview because we'd love to hear from them, going forward. So thank you so much for coming on the program today, Dr. Joseph Simone. Let's tell them where your office is.
So I'm located in West Babylon, Suffolk County, Long Island, at 555 Little East Neck Road. And if you'd like to contact me, it would be 631-321-5444. And Dr. Calapai, thanks so much for allowing me to...
My pleasure. Great to have you here and great to learn all this wonderful information. I know that there are many, many, many people who need to know this, and that's why we're going to keep giving information out with every podcast that I do. We'll keep doing some great lectures, and again, we'd love to have you back to do some more updates and things.
I'd love to come back. Thanks
Wonderful.
so much.
Thank you so much. So, friends, starting tomorrow, which I think is Saturday the 28th, if my numbers are correct. I'm looking at my engineer, producer, Frankie. He's got everything battened down and perfectly set up. Tomorrow, we're going to start doing live call-in shows. So I've mentioned this before, and the time has come. I'll be here tomorrow, Saturday the 28th, at about 2 o'clock, 2:30, depending upon what time I get finished seeing patients. And we're going to go live, and people can call in and ask you a question. The phone number that we'll have here is 888-420-9272, 888-420-9272. So the days of live calls and questions are back. So for those of you that hadn't either heard before or listened to the programs I've done over the better part of 34, 35 years, on various radio stations throughout the tri-state area and large venues, people would call and ask questions and give people an answer and ideas to how to understand their medical problem, what testing to do, what we might be able to do to help them out. So the more information we give to people, the better. So I anticipate this is going to be a great deal of fun, and I'll look forward to speaking to you. Certainly, if you'd like to call and ask a question, you could do that. 888-420-9272, 888-420-9272. Please take a look at the entirety of the podcast that we do and of course on YouTube, Spotify, and 15 other podcast platforms. We'd love to hear from you. There are many people who over many years have sent emails to the website, and we'd love for you to do that too. drcalapai.com, drcalapai.com. And the email to the office is ccmedical503@yahoo.com. So we love to keep in touch with you and chat. Upcoming are a couple of hormone segments for podcasts. We'll talk about thyroid hormone, how to evaluate that, why the approach that I do is different, more comprehensive in the different tests that we do for thyroid, DHEA, testosterone, evaluation and therapy, estrogen, progesterone, etc., IGF-I, or the active component of growth hormone. We'll talk about peptides. That'll be a whole segment of itself. And for recommendations in therapy, we'll have a whole segment on doing pellet therapy for testosterone for men, estrogen and testosterone for women. So we're able to place, after an analytic and blood work, and an algorithm to place little pellets under the skin so that you have nice, steady, even hormone levels throughout over the course of 4 to 6 months or so. So a lot of good information coming up. We'd love for you to take a look and give us a call. Thank you. Have a wonderful day.